Welcome to another deep dive. Today we're going to be talking about reversing disease, not just managing it.
Oh, cool.
Yeah, really exciting stuff.
Yeah.
We are going to be unpacking some amazing research from Dr. Dean Ornish.
Okay.
And this is based on his talk at the 2017 Global Wellness Summit.
Cool.
So get ready to discover how some simple changes can have a profound impact on your health.
I like simple changes.
Me too. Who doesn't?
Yeah, profound impact.
Yeah, and Dr. Ornish is a pioneer in this field. And
He is.
I think what's really exciting about all this is that we're not talking about some far-off future or anything like that.
Yeah.
This is stuff that he's been studying for decades. And his results are backed by solid science and inspiring patient stories.
And the stories are really what gets me.
Me too.
Yeah, the data is important. Of course, we want to see the numbers.
Right.
But the stories make it real.
Absolutely.
Yeah.
So let's get into it. Before we get to those specifics, though,
Okay.
let's talk about the foundation of his approach, the Ornish program. It's built around 4 core components.
Okay.
And I bet you can guess what some of them are.
Diet.
Yes. Of course, a whole foods plant-based diet,
Okay.
low in fat and refined carbs.
Makes sense.
But it goes beyond that. So
Stress management.
you got it.
Yeah.
Stress management techniques like yoga and meditation,
Okay.
moderate exercise like walking.
Gotta get moving.
Yep. And strong psychosocial support.
Ah, interesting.
Yeah, emphasizing the importance of love and intimacy.
So it's really holistic.
It is. It's the whole picture.
Yeah.
So to sum it up,
Right.
eat well, move more, stress less, and love more.
Sounds like a good plan.
Right. It's a recipe for a good life.
Yeah.
But, what really sets Dr. Ornish apart
Okay.
is his focus on finding the root cause of disease,
Okay.
not just treating those symptoms.
I like that. Get to the bottom of it.
Yeah, he challenges us to ask, what is the cause?
Right.
Instead of just slapping on those Band-Aid solutions. And his research suggests that by addressing those underlying causes,
Yeah.
we can actually reverse some of the most prevalent and debilitating conditions out there.
Wow.
And we're going to start with heart disease.
Oh, big one.
Huge.
Yeah.
So in his groundbreaking lifestyle heart trial,
Okay.
Dr. Ornish put his program to the test.
Makes sense.
He tracked the progression of heart disease in 2 groups.
Okay.
One following his program, and a control group that was just following standard medical advice.
The usual stuff.
Yeah, and get this.
Okay.
The group following the Ornish program had a 99% success rate in stopping or reversing their heart disease.
99%.
That's not a typo.
That's incredible.
99%.
Wow.
That's not just a small improvement, it's a complete game changer.
Totally.
And to make it even more clear, they used quantitative arteriography, which is a very precise measurement of how clogged arteries are.
Okay.
And this was to visually show the improvement in that group compared to the worsening condition of the control group.
So they could actually see it.
Yes, it's not just numbers on a chart.
Right.
It's visual evidence.
Powerful.
It is. And here's another crazy stat for you.
Okay.
The control group experienced 2.5 times more cardiac events, like heart attacks and strokes, than the group following the Ornish program.
So it's not just preventing things from getting worse.
Yo.
It's actually preventing those major events.
Exactly.
Wow.
It's really powerful stuff.
Yeah.
And he shared some pretty inspiring stories
Oh, I love the
of
stories.
patients who were so sick that they were on the waiting list for heart transplants.
Wow.
After following his program, their condition improved so much they no longer needed the transplant.
That's amazing. That's what it's all about.
I know, it gives me goosebumps just thinking about it.
Yeah.
Makes you wonder if this can work for heart disease.
Right.
What about other conditions?
That's the question.
Dr. Ornish didn't stop there.
Of course not.
He also studied the impact of his program on men with early-stage prostate cancer. What they found was that the men who followed his program were able to slow, stop, or even reverse the progression of their cancer.
Really?
Yeah, and this is where the data gets really interesting.
Okay.
Think of PSA as
Yeah.
a kind of signal flare that goes up when there's prostate cancer activity.
Do it.
The men in the Ornish program
Yeah.
saw their PSA levels decrease.
That's good.
Yeah, while the control group saw theirs increase.
Oh, wow.
So there's a real clear difference there.
Yeah.
They also looked at actual tumor growth in the lab.
Okay.
Prostate tumor growth was inhibited by 70% in the experimental group compared to just 9% in the control group.
Wow. That's huge.
It is. To put that into perspective, a study in the New England Journal of Medicine found no survival benefit from surgery or radiation for early-stage prostate cancer, and those come with significant side effects.
Well, this is a much gentler approach.
It is.
With better results.
Yeah, so it really makes you think.
It does.
Are we approaching healthcare the wrong way?
Maybe.
Focusing on these powerful lifestyle changes should be the first line of defense, not a last resort.
It's a really interesting thought.
It's a paradigm shift, for sure.
Yeah.
And Dr. Ornish isn't afraid to challenge the status quo.
He's a pioneer.
He is. And there's one more area of his research that I find particularly fascinating. His work with telomeres.
Telomeres, those are a bit tricky.
They are. They are. Can you break those down for our listeners?
Sure. Imagine telomeres as like the plastic tips on your shoelaces.
Okay.
They protect your DNA from fraying.
Right.
And as we age, those tips get shorter and shorter.
Makes sense.
The shorter your telomeres, the more vulnerable your DNA becomes. And that's linked to all sorts of age-related problems.
Okay, so shorter telomeres, not a good thing.
Not ideal, no.
So what did Dr. Ornish discover about telomeres?
Well, working with Dr. Elizabeth Blackburn,
Oh, wow.
a Nobel Prize winner who knows a thing or two about telomeres,
She does.
they found that the Ornish program could actually lengthen telomeres.
Hold on, lengthen. Are we talking about reversing aging here?
It certainly seems that way.
Wow.
And the more people stuck to the program, the more their telomeres lengthened.
This is some groundbreaking stuff.
It is.
So what's really remarkable to me
Yeah.
is that it's not about finding a specific cure for each disease.
Right.
It's the power of a healthy lifestyle to address the common underlying causes of so many conditions.
It's like hitting the reset button on your health,
Exactly.
allowing your body to heal and function optimally.
But let's be honest, sticking to any kind of lifestyle change long-term can be tough.
For sure.
What's the secret sauce of the Ornish program? How do they get people to stick with it?
That is the million-dollar question. Yeah, it is a tough question.
It is.
You know, you might think
Yeah.
that fear would be a good motivator,
Right.
you know,
Yeah.
change your lifestyle or else.
Right.
But it turns out fear isn't very effective in the long run.
I can see that.
Yeah.
We might make temporary changes out of fear,
Yeah.
but as soon as that fear subsides, we tend to fall back into those old habits.
Exactly. Instead of relying on fear, the Ornish program focuses on something much more powerful. Our desire for freedom and control.
Okay.
When you frame these lifestyle changes as choices you make to feel better and take charge of your health, they become empowering, not restrictive.
So it's about ditching that I have to mindset.
Yeah.
And embracing the I choose to mindset.
Exactly.
That makes sense.
It's a subtle shift, but it can make all the difference. And the program goes even further by emphasizing the importance of love and support, both from the staff and from fellow participants in support groups.
That sense of community and connection can be so powerful.
Oh, absolutely.
Knowing you're not alone on this journey
Yeah.
can make a huge difference.
It makes all the difference. It's about creating a supportive environment where people feel encouraged and motivated to make these changes, not just for themselves, but for each other.
That's a powerful thing.
It is.
So it seems like
Yeah.
Dr. Ornish has really cracked the code on sustainable behavior change.
Yeah, I think so.
And the impact goes beyond individual health as well. Right. He's also looked at the economic side of things.
Oh, of course.
Which is super relevant these days.
Absolutely. It's a critical piece of the puzzle.
It is. And the data is pretty impressive.
Yeah.
Remember we talked about how a small percentage of people account for a huge chunk of healthcare costs?
Right.
Well, the Ornish program targets those high-cost individuals, and the savings are substantial.
They are, yeah.
Give me some numbers.
Right.
I know our listeners love the details.
In one study with Mutual of Omaha,
Okay.
they found that 80% of participants who chose the Ornish program
Yeah.
were able to avoid expensive interventions altogether. Things like bypass surgery or stents
Wow.
saved almost $30,000 per patient in the first year alone.
That's not chump change.
No, it's not.
And it makes you wonder why this approach isn't more widely adopted.
Right. It's starting to gain traction, though.
Okay.
Highmark Blue Cross Blue Shield, they saw similar results.
Okay.
Cut their costs in half in the first year by incorporating the Ornish program. And for their highest cost patients, they saw a 400% reduction in healthcare costs.
That's incredible.
It is.
Underscores the potential of lifestyle medicine to create a more sustainable and affordable healthcare system.
Absolutely. And it's not just about saving money.
No.
It's about something much bigger.
It is. It's about shifting the focus
Right.
from disease management to true health and well-being.
Exactly. Empowering individuals to take control of their health destiny and live their best lives.
You know, something we haven't talked much about yet
Yeah.
is the impact of loneliness and depression on health.
Oh, that's an important one.
It is. It seems like Dr. Ornish recognizes the importance of addressing those as well.
He absolutely does, yeah.
He understands that it's not just about what you eat and how you move.
Right.
It's about the quality of your connections and your sense of meaning and purpose.
It's all connected.
It is, and those things are often overlooked in conventional healthcare.
They are, yeah.
Yeah.
Unfortunately.
But the research shows that loneliness and depression have a significant impact on our physical health.
Who'd he do?
People who are lonely and depressed are 3 to 10 times more likely to get sick and die prematurely from a whole range of causes.
It's true.
Compared to those who have strong social connections and a sense of purpose.
That's a pretty sobering statistic.
It is.
It really highlights the need for a more holistic approach to healthcare.
Yeah.
That addresses the social and emotional aspects of well-being.
And the Ornish program does just that.
It does.
It fosters a sense of community, connection, and belonging among participants.
Absolutely.
Remember those support groups we talked about earlier?
Yeah.
They play a crucial role in creating that supportive environment.
They really do. It's not just about learning about healthy habits.
Right.
It's about connecting with others who are on the same journey.
Exactly.
Feeling supported and encouraged, which can make all the difference.
It does.
When it comes to sticking with those lifestyle changes.
It's huge. And that brings us to another powerful aspect of the Ornish program, the emphasis on meaning and purpose.
Ah, yes.
Tell me more about that. I'm really curious how that plays into the program.
Well, Dr. Ornish doesn't just tell people what to do.
Yeah.
He helps them understand why they're doing it.
Okay.
He asks them a simple but profound question. Why do you want to live longer?
That is a good question.
It is. It really makes you stop and think about what truly matters to you.
It does.
By encouraging people to reflect on their values and aspirations, he helps them connect their lifestyle changes to a deeper sense of meaning and purpose.
So it becomes more than just losing weight or lowering cholesterol.
Exactly. It's about living a life that is aligned with their deepest desires.
It's about creating a life worth living.
Yes.
And that makes those healthy choices much more sustainable.
It does, because they're driven by something bigger than just the desire to avoid disease.
Exactly. It's about shifting from a place of fear and restriction to a place of empowerment and choice.
That's a powerful message.
Powerful message.
It makes you realize that we have more control over our health and well-being than we often realize.
More than we think. That brings us back to the question we posed earlier. If our natural state is to be healthy and happy, what choices can we make today to align with that potential?
Big questions.
Big questions. But before we go too deep into that, I think it's important to understand how these lifestyle changes actually work on a biological level.
That's a great point.
So in the final part of our deep dive,
Right.
we'll explore the science behind these transformations and uncover the specific mechanisms by which lifestyle changes impact our biology.
Looking forward to it.
We'll also delve into some practical steps you can take to incorporate these principles into your own life.
Sounds good.
All right, welcome back to the final part of our deep dive.
The grand finale.
It is into the fascinating world of lifestyle medicine.
Yeah.
We've been talking about the incredible power of these simple yet powerful changes.
They are simple.
They are to not just manage, but actually reverse disease.
Right. And I think now it's time to lift the hood.
Okay.
And take a look at the science behind how this all works.
The nuts and bolts.
Yeah, it's one thing to hear about amazing results, but I think understanding the mechanisms can be really empowering.
It can, yeah.
So what's actually happening inside our bodies when we adopt these healthier habits?
Well, it's like you're turning on the good genes
Okay.
and turning off the bad ones.
I like that.
Dr. Ornish's research showed that over 500 genes
Wow.
were affected by lifestyle changes.
That many.
Over 500. In just 3 months.
That's a serious transformation.
It is.
What kinds of genes are we talking about here?
Genes associated with things like tumor growth and inflammation.
Got it.
Those were dialed down.
Okay.
While genes involved in DNA repair, immune function, and antioxidant defense were cranked up.
So it's like you're literally rewiring your body for health at a genetic level.
That's a good way to put it.
That's incredible.
It really is. And remember those telomeres we talked about? Yes, those protective caps on our DNA.
Those guys, yeah, the Ornish program has been shown to actually lengthen telomeres.
Wait, so we're really saying here that we can actually turn back the clock on aging?
The research suggests it's possible.
I'm in.
Sign me up.
That's amazing.
And the more people stuck to the program,
yeah.
the more their telomeres lengthen. It's like hitting the rewind button on cellular aging.
I knew there was a reason I was feeling so youthful today.
I know, right?
But seriously, this is mind-blowing stuff. It makes you realize we have more control
We do.
over our health and longevity
We really do.
than we ever thought possible.
It goes beyond just genes and telomeres.
Okay.
Let's talk about inflammation for a minute.
Right.
You know how chronic inflammation is a major contributor to all sorts of health problems?
Yeah, it's like a constant low-grade fire
Yeah,
smoldering inside you.
exactly.
Not a good feeling.
No, not at all. Well, studies have shown that a plant-based diet, like the one in the Ornish program, can significantly reduce inflammation throughout the body.
That makes sense. What about the stress management techniques?
Oh, yeah.
How do those fit into the picture?
Well, stress is a huge contributor to inflammation.
Okay.
Yoga, meditation, and other stress-reducing practices, they help calm the nervous system and lower those stress hormones that fuel the fire.
Right, those stress hormones.
Yeah, exactly.
So it's like a multi-pronged attack on inflammation.
That's a good way to put it.
Addressing it from both a dietary and a lifestyle perspective.
Precisely. It's not just about treating the symptoms. It's about getting to the root of the problem.
Yeah.
And that's really the core message of Dr. Ornish's work. Our bodies have an amazing capacity to heal
They do.
if we create the right conditions.
It is empowering to know that we're not just victims
Yeah.
of our genes
Right.
or our circumstances.
We have the power to influence our health destiny.
We do, but for someone who's just starting out on this journey,
Yeah.
it can all feel a bit overwhelming.
It can be a lot. Where do you begin?
Where do you even begin?
You know, it's like anything else.
Yeah.
You don't have to climb the whole mountain in a day.
Right, right.
Start with small, manageable steps.
Okay.
Choose one area that resonates with you
Okay.
and focus on making gradual changes.
So maybe swap out one meat-based meal a week for a plant-based one,
Exactly.
or try a beginner yoga class online.
Perfect. It's not about perfection. It's about progress.
Progress, not perfection.
Exactly. Find what works for you and build from there.
And celebrate those small victories along the way, because every healthy choice we make is a step in the right direction.
Absolutely. And remember, you don't have to do this alone.
Right.
There are tons of resources available to support you.
There are.
Check out Dr. Ornish's website, explore online communities, find a buddy to join you on this journey.
Having that support system can make all the difference.
It really can.
Well, I have to say, I'm feeling incredibly inspired
too.
by the possibilities of lifestyle medicine.
Yeah.
It's given me a renewed sense of hope and optimism about our ability to create a healthier and happier future.
It's powerful stuff.
For ourselves and for generations to come.
Absolutely.
So thank you for joining us on this deep dive into the transformative power of lifestyle medicine.
It's been a pleasure.
Until next time, keep exploring, keep learning, and keep choosing health and happiness.